Welcome to this introduction on corticosteroids. But before we begin, it should be noted that a full transcript and references will be posted in the description below. First, what do corticosteroids do? So corticosteroids are a specific class of steroid hormones that closely resemble the natural hormone cortisol. Within the broad class of corticosteroids, there are two major subdivisions, glucocorticoids and mineralocorticoids. Glucocorticoids are involved in a diverse range of physiological processes. Primarily, they are employed for the regulation of inflammation, but are also capable of modulating the immune and stress responses, carbohydrate metabolism, blood electrolyte concentration, and the catabolism of enzymes and proteins. Glucocorticoids can also act in carbohydrate, lipid, and protein metabolism to increase hepatic capacity for gluconeogenesis, which is part of the energy production pathway in humans. Mineralocorticoids are more so involved in the regulation of water and electrolyte balances in the nephrons of the kidney, as evidenced by the mineralocorticoid aldosterone. Mineralocorticoids are indicated in diseases of immunity, inflammation, and electrolyte balance, where they are used at higher than replacement doses. The delivery of corticosteroids is usually site-specific because they work to reduce local inflammation, and therefore need to be delivered accurately in order to provide optimal benefit. However, there are three overall methods of delivery. The first and the outlier to this trend is a systemic delivery, which is used for corticosteroids such as prednisolone, hydrocortisone, and dexamethasone. A systemic delivery refers to when the drug is delivered to the entire bodily system through ingestion. Systemic delivery is used in long-term treatment of allergic and inflammatory disorder, or for the suppression of autoimmune diseases as part of a chemotherapy regimen. However, the long-term use of oral glucocorticoids brings with it several potentially deadly side effects, such as metabolic disease and cardiovascular disease, which occur as a result of the corticosteroids' modulation of the carbohydrate metabolism. The second delivery system is inhalation, where the drug is usually suspended into a liquid solution that is then sprayed into the esophagus in order to target inflammation of the respiratory system, such as asthma. The third targeted delivery system is a series of topical creams and gels used to treat local inflammation and itching, as we see in skin diseases such as eczema. However, prolonged use of topical corticosteroids can also cause systemic side effects as the drug enters the circulatory system. One example of a systemic corticosteroid is dexamethasone, which is a glucocorticoid that is used in a broad range of conditions including rheumatic issues, severe allergies, asthma, and COPD, which is chronic obstructive pulmonary disease. It is used in these conditions because of its strong anti-inflammatory properties, which negates the excessive inflammation and resulting pathologies of these conditions. It is usually taken orally in the morning and at night in an attempt to mimic natural cortisol levels. It is a synthetic adrenocorticoid that has significantly minimal mineralocorticoid activity to make sure that water and electrolyte balances aren't as affected as in other corticosteroid medications. In preterm labor, dexamethasone is used to improve respiratory outcomes in an unborn baby, and it is supplied either orally if time permits, or as an injection into a muscle if efficacy is needed immediately. In brain tumors, dexamethasone is injected into the muscles in order to help prevent edemas, which are pressure buildups that then subsequently damage the other areas of brain tissue. Corticosteroids are used primarily in order to reduce inflammation, and therefore most of the diseases for which it is indicated are conditions where the body's normal inflammatory process has begun to interfere with normal functioning. Inflammation is originally intended as a protective response, which involves cells such as the resident macrophages, dendritic cells, and histiocytes, recognizing some stressors and then sending a message to the brain telling it of the issue. The body responds to this by vasodilating the blood vessels in the affected area so that much more blood flows to the area and causes it to become raised, red, and stiff to the touch. The permeability of the blood vessels also increases, which results in plasma proteins leaking into the tissue, causing swelling. Under normal functioning, the body strictly regulates the inflammation response. However, chronic inflammation occurs under several conditions leading to cell damage, blockages in proper flow of air liquids, and in improper site drainage. These conditions manifest themselves in the forms of hay fever, rheumatoid arthritis, asthma, and periodontitis. Therefore, when this regulation is out of the body's control, modern medicine introduces the use of corticosteroids in order to downregulate the inflammation response and ensure that there is no destruction of the tissue and other side effects associated with the out-of-control innate immune response. In the case of asthma, the airways become hypertensive to environmental triggers such as pollen, dust, or smoke, and this causes an unwarranted and over-implementation of the body's natural inflammatory response, which means that the airways get inflamed with excessive blood flow and proteins, causing them to narrow, making breathing difficult. Therefore, inhaled corticosteroids are required to reduce the inflammation of the bronchioles so the bronchioles are once again able to deliver the air to the pulmonary system, so that the individual does not enter an oxygen-deprived state. The applicability of corticosteroids in asthma is however limited by the fact that the efficacy of corticosteroids has a genetic basis, with a large subgroup of asthma sufferers being corticosteroid resistant. Rheumatoid arthritis is an autoimmune condition wherein patients present with pain and swelling in their joints. This is because the systemic inflammation of the joints leads to the destruction of some of the joint tissue, following which the body tries to compensate by hastily growing new tissue. The accumulation is due to the prolonged inflammatory response, and by administering anti-inflammatory drugs such as corticosteroids, the blood flow and subsequent delivery of these immune cells to the area can be reduced, meaning less hyperplastification occurs and the joints are less painful and inflamed. So how does this actually work? Well, some conditions, including allergies and inflammatory bowel disease and autoimmune disorders such as rheumatoid arthritis, cause the immune system to respond abnormally or excessively by overactively attacking the foreign materials or attacking the body cells, resulting in swelling, pain, and disability. Dexamethasone reduces these inflammatory symptoms and tissue damage by regulating the immune system's response to these conditions. In order to trigger the immune response, two signals are required to stimulate the proliferation of the T lymphocytes, which are a subtype of white blood cells. These signals are created when the T cells recognize antigen-presenting cells as cells that have been infected by foreign material, and when T cell receptors bind to their corresponding antigens. These signals activate B lymphocytes, which release antibodies against the antigen and macrophages which engulf the foreign material, while also activating cytotoxic T cells, which are responsible for killing infected cells with toxins. This mechanism creates a buildup of white blood cells in the infected area, as they attempt to rid the body of toxins and foreign material, which is causing the swelling and pain. Dexamethasone reduces these symptoms as it is shown to inhibit the natural pathway by preventing the proper cell division of specific T cells that are named CD4, which is a helper T cell, and CD8, which is a cytotoxic T cell. The drug causes a reduction in the expansion index of T cells, which is a ratio of initial and final cell count after exposure to dexamethasone, and also a reduction in the proliferation index, which is the number of divisions that the cells in the postmitotic stage have undergone. It affects T cell differentiation by creating less effector memory T cells. If the body experiences excessive inflammation, it could lead to the development of bacterial meningitis. Therefore, anti-inflammatory drugs are useful in avoiding this. Dexamethasone also helps prevent the production of pro-inflammatory signaling properties, which are cytokines released by the macrophages, called IL-8, reducing morbidity and mortality caused by the infection, and the extent of the inhibition corresponds to the volume and consumption of the drug. It has been recognized that glucocorticoids have direct interactions with the transcription of the genetic material, which occurs when glucocorticoid receptor binds to specific DNA sequences and either induces or represses transcription, affecting the expression of those genes. It also interferes with the upstream signal transduction, which affects the early stages of a signaling pathway and varies the stability of the ribonucleic acid strands, RNA. But as beneficial as dexamethasone is as a pharmaceutical drug in treating many diseases and disorders, there are also many disadvantages associated with it. It has been recorded that a large percentage of primary brain tumor patients that use this drug have developed hyperglycemia and eventually diabetes, because it promotes glucose production in the liver, and the cells become less sensitive to insulin's regulatory function, creating a buildup of sugar in the blood. There is an approximate 10% risk of patients on this medication and other glucocorticoids developing symptomatic steroid myopathy, which involves the weakness in the limbs, as it can break down skeletal muscle caused by the inhibition of protein synthesis in the decomposition of protein. The risk is higher for elderly patients and those who use high doses for longer periods of time. This disease may lead to complications such as wasting of the pelvic girdle, weakness of the proximal arm, muscles and the neck, and the respiratory muscles. While there is a risk of limb weakness, this drug could also cause the thinning and the weakening of bones, known as osteoporosis, increasing the chances of broken bones even from small little bumps. The risks and symptoms are positively correlated with the duration and dosage of the dexamethasone, which has been identified in some patients who developed peptic ulcers which appear in the stomach. The risks are higher in people who also use anticoagulants and those who have a history of upper gastrointestinal bleeding. Therefore, it may be safer for these patients to be directed away from glucocorticoids. The usage of dexamethasone could also lead to hypertension, cataracts, thinning of the skin, and some patients may show characteristics of Cushing's syndrome. Besides physiological complications, dexamethasone may also trigger mild mental health issues such as anxiety, irritability, and insomnia, which has up to 62% chance of developing in a patient, while more serious outcomes could be mania, depression, and psychosis. However, with a much lower incidence. They may also experience disturbances in their memory. These psychotic symptoms generally appear in the first week of treatment. However, the patient can be recovered from most as soon as the corticosteroid use stops. Considering that the extent of implications on the body and mind after usage of dexamethasone is highly dependent on the dosage and the amount of time that it is used for, it is only safe to use in small doses and not for a prolonged period of time. You have now been introduced to corticosteroids, and feel free to take the quiz and test your knowledge. Thanks for watching.